Good afternoon, everyone. Bonjour à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. My name is Kina Leclerc, and I will be your moderator. Je m'appelle Kina Leclerc.
My name is Kina Leclerc, and will be your moderator.
Before we begin, a quick reminder to place your phone on mute until I invite you to speak or to ask your question. And please do not place the call on hold. Available for questions from the media, we have disponible pour répondre aux questions des médias, nous accueillons. In Council Chambers, Mayor Le Maire Jim Watson, Steve Kanellakos, City Manager, Directeur Municipal, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence. Phoning in today, we have Councillor Keith Egli, Chair, Ottawa Public Health Board, le conseiller Keith Egli, Président du Conseil de santé d'Ottawa, and la docteure Vera Etches, Medical Officer of Health, médecin-chef en santé publique. I will now invite each agency to ask their question. You may ask one question with one follow-up. Par ordre alphabétique, j'invite maintenant chaque...
By alphabetical order, I would like every agency to ask their question.
All, please try phoning in again or contact Media Relations to submit your question. So we will now start with Matthew Cooper at CBC Ontario.
Hi, can you hear me?
Yes, we can.
Great. Okay. So I guess this first question, it's directed at Mayor Watson and Dr. Etches. I guess some people are taking some optimism in the trends and the cases as we're seeing them in the Ottawa area, the vaccine rollout and such things. And there's talk about whether or not the stay-at-home order is to be extended. And previously, you've talked about regional reopenings and a more regional approach to COVID-19. Do you think that that is something that should be considered at the stage that we're in with what we're seeing right now? Should the stay-at-home order be extended in Ottawa, or should we be looking at a more regional approach for this area?
Maybe I'll ask Dr. Etches to comment, and then I'll offer a follow-up. Mike, thanks.
Yes, thank you for your question. I am encouraged by the figures in Ottawa. We see a slow decline in COVID in our wastewater and an important decline in hospitalizations, which tells us that people are being protected by vaccine at older ages, and the level of serious illness is coming down. Of course, we do continue to have quite a high level of COVID in the community, and unfortunately, we are still seeing deaths due to COVID. So we have to continue to be cautious. The level of protection from vaccine isn't enough to stop a resurgence at this point, and the stay-at-home order is what's working right now to really bring the levels down. So what I am encouraged by is that the conversation about being able to open schools is happening, and that is something where I think the regional approach is a valid way to go in terms of some parts of the province already have very low rates of COVID, and so that's something being considered, and I think that's the first step. We need to get schools open, and then we need to take a look at other measures that could be relaxed.
Yeah, Matthew, obviously I concur with Dr. Etches. I think the first priority for all of us here is to get our school system back up and running, at least so the kids could have at least a month in class learning. I think that's a great priority, both for their mental well-being and that of their parents and caregivers as well. And I think that should be done on a regional basis. If our schools are in good shape, our numbers are in good shape, they're going in the right direction, I think we should be allowed to open our schools at that time when it's safe, and not simply wait for all of the challenges they're facing in Peel and Toronto, which our heart goes out to those communities because, excuse me, they're suffering greatly. But I believe opening the schools on a regional basis makes good sense.
Okay, this is more, I suppose, for Dr. Etches, Mr. DiMonte, and I guess if somebody else from the council political side wants to weigh in, I'm not sure, but with the shelving of AstraZeneca first doses, it's certainly something that people are raising people who are vaccine hesitant may be raising as a reason to wait even more. This obviously will affect, to whom first doses can be administered. And after the NACI recommendations came out, pretty sure I was on one of these calls where I was hearing, again, the refrain, the first shot you can get is the best shot. What does this change in strategy coming from Dr. Williams from the province? What does this mean for, I guess, how you're dealing with the vaccine rollout here? And are there any things that you think people who may have received that shot need to be hearing today?
So maybe I can Oh, sorry. Go ahead, Dr. Etches.
Sure. I think the information yesterday was sudden and new for people, and I think it's important to understand where it's coming from and the context. So it's arising out of the ongoing system to monitor any adverse events following immunization, and that's an important process to continue to evaluate vaccine safety. And so Dr. Williams was flagging the data that's showing potentially the risk of blood clots is happening more frequently than they had thought. And in the context where we have an increasing supply of other vaccines, that's where his recommendation was stemming from, that we can point people to accessing vaccines that aren't associated with this. And so it's important for people who have had the AstraZeneca vaccine to understand they did the right thing to choose to be protected with a COVID vaccine while COVID rates are high in our community, and that was the vaccine available to them. We want to continue to let people know what to look for after they've been vaccinated. If you see any concerns with a headache or concerns that you're just feeling short of breath or you've got severe abdominal pain, something that seems unusual after vaccination, to report that and to seek care right away if needed. There are good ways to diagnose these kinds of blood clots. Between 4 days and 28 days after vaccination is the period where people are identifying this as a risk. It's rare, and there are ways to look at treating this and providing supportive care, so that it is important for you to look for those symptoms. The vaccine program in Ontario didn't rely heavily on AstraZeneca as a supply, and so I think that's where Mr. DeMonte may want to describe, that we will be able to continue to get to a place very soon where anyone over 18 is able to have vaccine access. So I'll pass it over to him.
Thank you, Dr. Etches. I guess on a more reassuring side of things, so as you know, we had two streams where AstraZeneca was provided. The first was going to pharmacies, and the second was going to primary care and the physicians. So this pause certainly, has an impact there. That said, there was already developments and undergoing right now to move Moderna to certainly pharmacies, and we're looking at that for primary care as well too. So work was already underway. So while there is a bit of a hiccup now, if you will, as a result of this AstraZeneca pause, it would just impact those two streams, which already we were looking at other solutions. I think Dr. Etches just talked. I know a lot of people now are thinking, well, I got my first AstraZeneca, what happens? I'm sure we'll get more information from the scientific community and what next steps will be there. But I want to encourage people on the other side, it's not impacting our rollout at all, and that continues. So I would say that while, this was, as Dr. Etches said, a sudden announcement yesterday, and it does have impact on those two streams, other options are being developed, and I think that'll be up and running shortly as well too. So it shouldn't have a significant impact in the overall rollout plan.
Yeah, good morning. It's Keith. It's Keith Eglai. Just a quick comment. I'm one of the people that did get AstraZeneca, and I certainly don't regret it. It was the best legal advice at the time with what we knew, and I don't think anybody should regret the fact that they got that first shot. I can say what I'm hearing from individuals, though, as a counselor and as the chair of public health, is for those who did have the first shot, where are they fitting into the second shot rollout? Because they went through the pharmacies or through the through a primary caregiver, not through the provincial system. And so many don't have a date for a second shot. So I think what people want to hear from the province sooner rather than later, that there is a plan in place to address people who are in that cohort, who had the first shot and don't necessarily have a date for a second shot. And they just want to know that they're not forgotten, that they're still in the queue and will be taken care of. I'm confident that the province will come up with a plan, but I think that needs to be communicated sooner rather than later to the people out there in that set of circumstances.
And so it's Vera Estes again. I will underline for people that everyone who's had a first dose of any COVID vaccine, there is an information system that lets us know when your second dose is due. And so that is the work that we will be doing locally with the province, is to let people know when you can get your second dose, what it will be, where you can book it. And there are technical pieces that the province is working on to be able to book just a second dose only in the provincial system. We know this is coming, and we'll continue to make sure people know about it at the right time.
Thank you, everyone.
Hi, good morning, everyone. My question, as I think City Manager, Mr. Kanalakis, I'm asking a couple of questions about the city's lawsuit over the Rideau sinkhole reported today. I understand, I've seen the confidential memo that was sent out, I think it was Monday. I was wondering if you could both start with some comments on how you feel about the fact that the city's own insurers have denied the soft costs related to the Rideau sinkhole.
I'll begin, Joanne. Obviously, because the matters before the courts, we can't get into too much detail, but I can say the action that we're taking, the legal action that we're taking, is obviously to ensure the protection of our taxpayers. We feel we have a very solid case, and that's why we notified members of council yesterday, and the court action documents have been filed. And we expect to receive word back from the court in the next couple of days that it has been received. So, Mr. Kanalakis.
Thank you, Mr. Mayor. Hi, Joanne. I'm not surprised. I mean, I think the insurance companies are, look at these things. They're big claims. RTG also has a significant claim against them and against us. And so, they rejected our claim. And so we're following the process to protect our taxpayers and ensure we protect ourselves from RTG in the event their claim is successful.
Okay, thanks for that. Part of the memo talked about the hard costs were actually from the Rideau Transit Group, that they were covered. Can you talk about what kind of costs are hard costs and how much did those total? Thanks.
Thank you, Joanne. The hard costs for RTG, I can't disclose that number. That's obviously confidential with them, but they covered the actual costs, or some of the costs, I should say, for the immediate repair of the sinkhole after it happened, the work that was happening there. So they got some of their costs funded in terms of the hard costs. And in terms of the cost for the city, I don't have the exact number, but they were very minor. There were a lot to do with police paid duty to cover there. There were some other, traffic issues that we had to manage and reroute the buses and things. And so they covered some of those, but it was a very small amount compared to these. But I can get you the number after. I just don't have the specific one with me right now.
Okay, thanks. So just to clarify, the city got some of their hard costs from RTG, or the bulk of them from RTG, and some from their insurers?
No, we've got the RTG got some of their hard costs from the insurer, and the city got our hard costs from the insurer.
Thank you very much.
Okay, thanks.
Moving on, we will go to Chris Curries at City News, Ottawa.
Good morning. This would be a question, I believe, for Mr. DeMonte. You talked about how the AstraZeneca decision won't affect the city's rollout. How many doses of the AstraZeneca vaccine does the city currently have?
That's a good question. I number with me. If I'm not mistaken, we were getting somewhere in the neighborhood of 11,000. We had 11,000 doses initially given to the public health unit, so the city would receive that through our public health team, and that was assigned to the primary care. The AstraZeneca that would go to the pharmacy went directly from the province, so those numbers we don't have, and I don't know right off hand what's still in hand as a result of the pause decision. I think the team's now kind of looking at that as we speak, but there was a significant portion that had been distributed and already been given to patients through the primary care group, and as well we saw the pharmacies too was quite popular. So I don't think it's a very large number in hand, but I can get that and then we'll make sure that it's followed up.
Perfect, thank you. And just to follow up, we're hearing some questions from readers and listeners, and they're wondering if any of the deceased victims of COVID-19 were vaccinated. I'm wondering if you could touch on that as well, just because we're hearing that a lot.
I can't. I can maybe ask if Dr. Etches wants to weigh in. I know the Chief Coroner of Ontario is looking at all deaths, but I don't have that number here for Ottawa or know in any way if they're related. So unless Dr. Etches, you have any information.
Yes, I can speak to that in general and specific numbers. The team is looking into this always. For every person who tests positive for COVID-19, we are collecting information about their immunization history, so we can get an idea about the effectiveness of the vaccines in preventing severe illness. And the death rates have dropped in the age groups that have the highest levels of vaccine protection. So in long-term care and retirement homes where people have 2 doses, the residents have 2 doses, we've seen a dramatic drop in deaths. I am aware that there is one outbreak right now where we have seen vaccinated people end up with a severe illness resulting in death. And, usually if we think about the context, these are the population over 80 who are, again, when we look, like Public Health Ontario's looked across the province of who might be testing positive for COVID after immunization. It is people over 80 who are most likely to have this result, and unfortunately we have seen deaths where often there is an association with an underlying health condition.
Thank you very much.
Yeah, I think, Joanne, if you're still on the line, Steve Kanalakis has that number for you.
Great, I'm sure everyone would like it.
Hi, Joanne. It's not overwhelming. It's $1.7 million was the city's recovery of its hard cost claims from the insurer, which is separate from what RTG would have recovered.
Thanks very much.
Thank you very much. Moving on, we will go to Ted Raymond at CTV Ottawa.
Hi there. This first question is for Dr. Etches. Just following up on the note that you sent to the province regarding a review of essential and non-essential businesses. We're just curious if you got a reply and what that reply was.
No, I have not had a specific reply, and certainly since that time, we've seen improvement in the COVID situation where levels at that time were rising, and now we see that the levels are coming down across the province. So that may be part of the context.
Okay, thank you. My second question is, I guess, for Mr. DeMonte. We're asking about how the progress of the pop-up clinics that are going on around the city. We had some reports of people being turned away at the Howard Darwin Clinic this morning. Could you just address, the process of how people can go to these drop-in clinics and what's required and why people might be turned away, even if they may have some of their neighbors may have gotten it the day before?
Yeah, so as we had indicated, and maybe Dr. Etches can weigh in too on the broader strategy with regards to why we're going in these communities. So these are our communities that have been disproportionately impacted. There are also individuals in those communities that are often more difficult to get to or to be in what I would call the more mainstream processes that we've put in place, our mass vaccination clinics. They have maybe trouble getting there. And we've let our public health team, I think, be very innovative, and they've got it in there with the different community groups, with faith groups, and we're, as I said previously, we're letting them experiment and try any way to get to some of these hardest hit individuals, and it is a little less structured than we would have in a mass vaccination clinic where, you know, the reports are when you arrive there, you flow through quite easily, and it's a really very streamlined, tight process. And each community and each neighborhood is very, very different, so we have to adapt. So there have been a few challenges. What's happened, unfortunately, is, and maybe that's the message today, if you don't live in those neighborhoods, please don't go to these clinics. These clinics are to be able to get to these individuals that need a different pathway to be able to get a vaccine, and that's why our teams are in there working very hard, trying to get to them, going door to door in some cases. And so to your very simple question, as we've adapted, there have been changes and adaptations, and it's created a few problems with regards to postal codes and where people live, but the team's now adapted and made that much clearer. And this morning, too, a couple of hundred people, unfortunately, had to be turned away because they weren't in that neighborhood. So they were going there, and they were going to get basically take vaccine from the people who really need it. So we're looking at that, and we're going to adapt and adjust, and hopefully these challenges don't happen as we go forward. But I think it's important, and I'd ask Dr. Etches to give you her insight about why the importance and why we're so open to trying to experiment in some of these neighborhoods, because it's so important to get to some of these individuals.
Yeah, so it's Vera here. This must feel frustrating and confusing to people who thought they were eligible and then were told when they showed up they weren't. So I want to say I think what's happened sometimes, and this maybe this morning, is that people initially who'd showed up, the staff on site really hesitate to turn people away. Although they are trying to target the communities at highest risk, there are times when, you know, if there's space in the clinic, they don't want to turn people away. However, when word gets out and people come from further afield, and if it's looking like the numbers showing up are going to displace the population that is really meant to be served by these pop-ups, then that becomes an issue. And so we will, Tony's working with the team to make this clearer and how do we communicate. But what I want to highlight is why these are occurring is because there are people who have transportation barriers, who have language barriers, who don't have access to the internet to book. And so it is important to have other options besides the big community clinics for people who might not be vaccinated otherwise. And that's what we're hearing from our partners who are doing this work. We have community health centers and the Ottawa health teams who are going door to door and doing this work. They are hearing from people, I wouldn't have gone to be vaccinated anyway. So I think that's the idea. If people are eligible, we are aiming to have that communicated directly, and the team's focusing in on this in terms of giving vouchers to people door to door to tell them this is coming to your neighborhood, this is your turn, right? So it's going to be clearer for those who are eligible, and if you're in a broader population group, you know, more access through community-based clinics. And I encourage people, I'm so glad to see your interest in being immunized. Use the provincial booking system. It's very soon going to be available for anyone 18 and over across the whole city. And that's the channel we encourage everyone to use as it becomes open to them.
Again, Keith Eglai, very quickly. So that pop-up clinic was in my ward, is in my ward, and as we try new things, there will undoubtedly be some bumps in the road. But I think the story here is over 3 days, we will have vaccinated 2,400 people in a community that is a community of concern from a public health perspective. And as Dr. Etch has said, some people that would not have otherwise known about vaccine opportunities or had access to the internet or a cell phone. So to me, the story here is 2,400 people that needed to be vaccinated in our city who may have had a struggle doing it otherwise have been vaccinated and will be vaccinated between Monday and the end of today. So to me, that's the story, and that's an indicator of what we can do. And yes, we'll refine it going forward. But I think we did some really good work in conjunction, public health and the city this week in getting to that population that needed to be gotten to in a different way.
Thank you very much, everyone. We will now go to Craig Lord at Global Ottawa.
Hi there. I don't want to belabor this point too much, but I wanted to ask about pop-up clinics as well. I'll just ask specifically about maybe this is to Dr. Etches, but maybe Anthony DeMonte could weigh in as well. Perhaps the limiting effect of doing this by postal code in a lot of ways. There's been a lot of discussion over the hotspots provincially and that kind of thing. But we're hearing from people at the Howard Darwin Arena who lined up that they were just one postal code over, and it's not like that makes them in a more or less vulnerable community, but that can shut them out from potentially getting a vaccine that day in a pop-up. So is that a limiting factor for how you do this rollout? And is there any way to massage that to be more inclusive of what an actual neighborhood that is hard hit by COVID actually looks like?
So maybe I can start, and if Dr. Etches wants to weigh in. I mean, I think you've finished your question. How do we massage it? I think that really is there has to be a line drawn eventually somewhere, and that is a challenge. And I think you're right. And some of these communities and these neighborhoods, it's pretty complex, right? At one street over, that type of thing. So the EPI team is providing us with the data. The epidemiological team of public health provides us with the data, and that's how we're driving through this, and we're actually prioritizing these neighborhoods based on the data that we have of those that have been most impacted. So we're literally going down, trying to prioritize and ensure that we're getting to those who need it the most. So I think, Chair Eglai mentioned it too. I think experimentation does lead to some of these challenges, but at the same time, I'm of the view that the team on the ground working with community partners, the public health nurses that are in there that are going door to door and knocking, we're seeing the results and we're seeing the impacts that we're having. It's worth a few challenges, and we'll try to adjust and be a little bit more precise as we continue going forward. But I think we need to continue to do that outreach in those communities. And as Dr. Etch has said, very soon anyone else 18 and over will be able to book on the provincial booking system. We'll probably open up more of our mass vaccination clinics as we get more vaccine. So the volume there will be done, but we still can't forget, and we don't want to leave behind those in those neighborhoods that are the most vulnerable. So we have to continue trying these different techniques, and they're experimenting, but there's people on the ground that work with these people every day, and I have a lot of confidence in what they do. They know these communities, and a lot of the work that they're doing there is truly quite amazing. So we have a few hiccups, but I think it's important to continue the work.
Thanks. I think this would also be for Mr. DeMonte about yesterday's vaccine rollout with the release of Group 2 and the at-risk health conditions being eligible to book. At what point did the city decide to open up more booking slots, some in May and into the first 2 weeks of June? Was the city surprised by the demand they got with yesterday's new eligibility?
No, I think actually it's really good news for this community, and I think it's a lot of the credit goes to the public health team with regards to the messaging they've put out there. Dr. Etches has been pretty clear the importance of us all getting vaccinated, the leadership at the political level with the mayor and council as well too. Every time we've put out vaccine appointments, they get booked up. We don't have the same challenges that we've seen, and I talk to my colleagues in the GTA and particularly Toronto on a regular basis. They have, bookings there and nobody books, and they're trying to get people in. That's never been the situation we've had here in Ottawa. As soon as we put appointments on the provincial booking system, because we have the vaccine, as I've mentioned this a lot of times, when we have confirmation of vaccines, we put it in the system. They get booked up right away. So that's really good news, and that's how we're marching through the numbers that we're marching through here in Ottawa. So I think that's very positive. So it hasn't been a challenge for us, and it continues to be a good news story. And so I would just, if anybody's listening, just give us more vaccine and we'll keep marching through our community.
Thank you.
Thank you very much. Nous allons maintenant passer à Julien Paquette à Le Droit.
Julien Paquette from Le Droit. Hello, everyone. My question is for Mayor Watson. I understand that for the legal issue that we have in front, that you can't provide any details. But I would like to understand a little bit better. So what are the fees that you're trying to recover from the insurer? What kind of costs are you trying to cover? It doesn't really need to be the specific amount, but what type of cost? Julian, right now, it's in front of the courts. I can't provide much details for right now. We will follow up closely the situation with the insurer. We want to protect our taxpayer and the City of Ottawa. That's the reason why we sent a memo to every council members. And the reason why also we went in front of the tribunals this week to make sure that we're protected. Thank you very much. Follow-up question. This is for Dr. Etches. I can't remember if it was last week or the previous week, but do you think that it would be acceptable to allow some sports to go on, such as golf or tennis, taking into account that these activities are allowed in the Ottawa region? Many residents from Ottawa are playing golf on the other side of the river. Yes, you mentioned two good points. I would like to say that it's very important for our mental health to go and play outside, to exercise. But we have to be careful, especially when we're having activities with members outside of our households. We have to select activities with low risks. The Ontario provincial decision to close some settings or to prohibit some activities such as golf what I would say is to please go play outside, taking all the safety measures necessary, and try to limit your contacts to your household. So try to select an activity or sport that is a lower risk sport. We've lived with different opinions from each side of the river, and this has been throughout the pandemic. Right now, it's important to keep on reducing the transmission of COVID-19 within the communities. One of the measures is to move slowly. So, of course, what would be nice is to have exactly the same thing on each side of the river, but we have to avoid traveling from one side to the other. I know we're going to be still a single community with the people in Gatineau. If some activities are non-essential, the bylaws still ask us to limit displacements. So for right now, you do not recommend the reopening of tennis courts or golf courses. I'm not against the reopening of these two activities. When we will reach that point, we will have to be careful and avoid contacts with people that are not part of our households. Thank you. Thank you so much.
To John Willing at the Ottawa Citizen.
Akina, thank you. It's a question regarding the lawsuit filed yesterday. I guess it's for Steve Kanalakis. Steve, the lawsuit memo says RTG is claiming $230 million against the city related to the sinkhole, $230 million. Can you offer any context at all as to what things RTG is pinning to that claim?
We have the, we have that claim, but I'm not going to discuss it, John, in terms of what the specifics are. But as you can imagine, it's the costs that they felt were related to the repair of the sinkhole and the delay that resulted from the sinkhole in terms of what it cost them to finish the project. So it's all wrapped up into repair and cause of delay on substantial completion. I can give you that as a general categories.
Okay, thanks, Steve. Shifting over to COVID, and as we know, Outaouais is going to see a bit of a reopening on Monday, and I'm wondering how that is going to affect the bridge enforcement. So I wonder if this is a question for Mr. DeMonte. Do you know in any way how that will affect enforcement of the bridges? Is the enforcement going to swing more heavily over to Quebec police responsibility?
The only thing I can tell you, the question is for the Chief of Police. The only thing I can tell you, I got a memo from him yesterday. They will continue enforcing the requirements that the Ontario government has asked them to do, the work that has them to do. So they continue doing their spot check type enforcement currently. And I think they're awaiting to hear from Solgen what the next phase will mean. So I think that's a little bit up in the air right now, of if that'll pivot to the Quebec side. Will the Quebec police forces take a part over, or they'll continue on the Ontario side with their continued enforcement? I think they're awaiting word from Solgen and more details to adjust their operational tempo based on that direction.
If I could just add to that, John, the Chief's memo that was sent, I believe, to members of council and myself indicated that they've obviously scaled back significantly from that first day and redeployed resources in the different crossings, the 5 bridges and 2 ferry crossings. So the chief also confirmed that they're keeping tabs on all of the costs, because we don't believe this should be borne by Ottawa police or Ottawa taxpayers. Thank you.
Thank you very much. We will now be going to Elizabeth Payne at the Ottawa Sun.
Hi, thanks very much. Back to AstraZeneca, Councillor Eglai suggested that he's hearing from people who are frustrated about this. We certainly are. I'm wondering who you're hearing from, what they're saying, and if you can someone can walk them through the steps of what happens next, what you're waiting for, what kind of information, what the timing might be.
Well, I think that's probably best answered by Dr. Etches and Tony DeMonte. I mean, I can say in general, if they say that people are concerned, they have one shot and they want to know what happens for AstraZeneca or Pfizer, Moderna. So they really want that uncertainty answered, and I think the sooner the province can give us direction in that regard that we can share with the public, the better off we'll be. But I believe Dr. Etches can speak in a bit more detail to process.
Yes. So what we know is that when people have a first dose, there's an interval until their second dose. And for most people in Ontario, that interval is 16 weeks right now. There's some specific populations shorter. And for those who received AstraZeneca, the product monograph, the way the studies were done and the company says the vaccine should be used is to have a second dose between 4 and 12 weeks. So there's a period of time where we know we need to be able to provide a second dose. And what the province has said is that it could be AstraZeneca that dose. We hear there may be additional supply coming to the country, and there could be AstraZeneca available. That would be an informed choice for people. Around the world, people are looking at the risk of a blood clot after a second dose of AstraZeneca, just as they were studying it after a first dose, and it appears much less frequent after a second dose that is a risk, so even rarer. And the other option that was alluded to by Dr. Williams was that it could be that people will have that choice for a different COVID vaccine as their second dose, that's something they specifically asked the National Advisory Committee on Immunization to study and make a recommendation. And so I do expect that this direction, these recommendations based on the science will come out in time to have people make the decision in an informed way about what they will have for their second COVID, booster dose of the vaccine. This is actually part of a bigger question that other people have who are waiting for their second dose, and they don't have an appointment. And so I spoke to earlier, again, the province is working on a technical solution for people to be able to book that second dose in the provincial booking system when they didn't receive their first dose in that booking system. And we do know how many people need a second dose when. All of that information is in the provincial information system, and they can calculate how many doses we need to reserve to have those second doses available on schedule. And so it won't be a problem with vaccine supply. There will be doses available for second doses when people need them. And there is a gap now in people having those second appointments booked, but that is something that there are people working hard at to make sure that's closed in time. And we will locally be making sure that people get those answers as soon as we can.
Okay, thanks very much. And for a follow-up, just further on the school question, both Dr. Etches and the Mayor, I believe, have emphasized that it should be a local decision. Have you made a request to the province along those lines?
We haven't made a specific request, but we've been discussing with the province what does it look like in terms of the COVID level in our community, in terms of making projections about when we would be able to open schools. And so what we've said is that it's looking positive to be able to open schools towards the end of May if the rate of COVID continues to come down in our community. We know that the schools, risk of having COVID brought into the schools is higher when the rates are higher in the community. Today, they're still high. There's still, 75 people testing positive per 100,000 per week. When we opened schools in February, we had rates that were near half that, but we're on a trajectory where we can be hopeful about that school opening process, and so we're sharing that hope with the province, and we're continuing to monitor. And so I think as we continue to go, week over week, we'll want to provide information and come to some joint decisions. Looking to the province to make some announcements about what their approach will be and inform parents, work with school boards But you can hear the desire is there to provide this essential service to children and families as soon as we can.
Okay, thank you.
Thank you very much. Pour terminer, nous allons passer à Antoine.
To finish, I give the floor to Antoine Trépanier from Radio-Canada. Hello. My question is for Mayor Watson and City Manager Steve Kanalakos. I would like to talk about timing. It's been already 5 years. I would like to know, why is it the timing right now to go in court? When did you feel the impact because you're suing this week? Why 5 years later? Like I said, Antoine, we can't really comment. Right now, it's in front of the tribunals. Me, as the mayor of the City of Ottawa, I have to work in partnership to try to find a solution. We don't have the same point of view. The insurer doesn't want to pay what happened on Rideau Street. That's the reason why we sent a memo to every council member. So this week, tomorrow and Friday, we will receive the documents from our lawyers, and the courts will decide how the situation will end up.
The reason that we've decided to go yesterday or file for the 11th is because there's an expiry on the limitation period. There's a limitation period on when we can actually file a claim to deal with this. The insurance company, obviously there's been years of negotiations and discussions, so they denied the claim. So we had to pull together our statement of claim to ensure that we got it in before the expiry of the limitation period, so that we don't preclude any potential recovery under the policy. So the city was protecting its rights by getting it in by May 11th to secure our place in the court with RTG to ensure we protect ourselves.
Thank you so much. Merci, Monsieur le Maire. Ma deuxième question est pour...
Second question, this is for Dr. Etches and also Mayor Watson. You were talking about school reopening. What is your actual position? We're almost 1 month before the end of school. How important it is to reopen the schools 1 month before the end? Because we understand that some medical officers of health asked to push back the reopening date. What's your opinion? I can start. Our objective with schools is to reopen the schools as soon as possible. We are following up the number of COVID-19 transmission within the communities. It is then easier to discuss with the province and to ask for the reopening of our schools. This will be a great help for the families, for the children. I have good hopes to reopen schools by the end of the month, if the trends keep on going that way. Today, the transmission level is higher than when we reopened the schools in February 2021. But if we look at the trends, the results are quite positive. It would be very interesting for the province to have an approach in which children can have access to school. If I may compliment, my next priority would be to reopen the schools. It's very important for the students, for their mental health, also to help the parents and the teachers. I talked to some MPs, provincial MPs, it's very important to look at the data. If we're going on the right path and that we can reopen schools, that would be good. The schools have been reopened in Gatineau, primary schools. Next week, it will be high schools that will be reopened in Gatineau. So now we want to see if the province will allow a regional approach to school reopenings. I would say that in Toronto and Hamilton, they're not in the same position as us. I think we're in a better position to reopen schools in Ottawa. Thank you so much. Thank you, everyone.
Bonne journée. Have a great day.
Merci.